right, welcome everybody. Come on in the room. I came on a little early so we can get some people in. We are live. We are going to be talking about the COVID-19 shots, the booster shots, and COVID-19 and lupus. And we're going to be speaking with Dr. Ashira Blazer. So we are going to give you all some time to come in. And hopefully you all can hear me because I have these little earbuds in. If you can hear me, give me a thumbs up, please, so that I know that everyone can hear me. I want to make sure that everything is clear and that we don't get any feedback. So today we are going to be speaking with Dr. Ashira Blazer. And I see she is in the room and she's ready. Let's go. Let's go. Let me get her in the room with us. Let's see. She is coming on in the room. You all come on in the room. Go invite a friend. Hey there, Dr. Blazer.
Hello. Wait, I am like
Yeah,
funny.
you got some shadowing going.
Yeah, I'm trying to use my iPad, and I think that it is. Wait.
Oh, I've never even tried to use the iPad. That's the funny thing.
Yeah.
Uh,
Me not look like witness protection somehow.
I know, I know that's right. You want to come? You want to come back on?
Yeah, maybe. Yeah.
Okay.
Or I can just step out. I think I can mess with the lighting. 1 second.
Okay. Oh, not a problem. I'll just talk while you're doing that. So yes, everyone, we are here to discuss COVID booster shots and all about COVID and lupus. And if you have any questions or if you have any concerns, this is the place that you can ask those questions. What I do want to say before Dr. Blazer comes back is that everything that we do here is for informational purposes only. What I need you to do is that whatever information you feel is good for you here, make sure you take it back to your own doctor and make sure that you understand that we are not liable for anything that is stated here in this forum. This forum is strictly for educational purposes so that you can be well educated while you're making your decisions. But make sure you always check with your doctor prior to changing anything or doing anything, and just consult with your doctor with everything that goes on. You like that look, Dr. Blazer? That's a little better. Yeah, it is. Yeah, just a little. Yeah. Yeah, you did kind of look like
I'm gonna sit on the pillow here.
That's all right. That's all right. Well, I'm so glad that we're able to talk to you today.
Yes, me too. Me too.
And so much talk about, excuse me, COVID-19 and the COVID-19 booster shot. So let's just dive right on in since, it's getting late and I want to be respectful of your time. Let's dive in. First tell us exactly what the COVID-19 shot is, and then lead us into what the booster will be for us.
Yes. Okay. So essentially what the shot is a vaccination, right? So what we're doing with these vaccines is training the immune system to be able to recognize COVID-19 in the case that you get it, right? So
Gotcha.
there are a number of different vaccines. The ones that we're using most commonly in the US are the mRNA vaccines. So that's the Pfizer and the Moderna. And then also the Johnson & Johnson vaccine, which is a viral vector vaccine. Okay. So, yeah, go ahead. So do you want to know a little bit about
I didn't know that. Yeah, I didn't realize that. I thought they were all mRNA.
No. Yeah, Johnson & Johnson.
Awesome. That's good information. Okay.
Yeah.
Writing down some notes here.
Oh, sure. Yeah. So the mRNA, it's interesting because, a lot of people are wary of the mRNA vaccines because it's a relatively newer technology. But I'm actually excited about it and less wary because it turns out that, so when we were looking at a potential Ebola vaccine, the mRNA technology was piloted. And so it has been in various phases of trials for the last
Right.
20 years or so. So it's actually not
Okay.
so new. And it's really interesting because, you know, if you think, I don't know if, so I'm old enough to have gotten chickenpox when I was younger, right? And so the way that our parents vaccinated us is one of our cousins got chickenpox and they put us all in the room. So we got chickenpox when we were young, right? Okay.
Exactly.
So, right. So what our parents were doing in that situation was they knew that it would be more dangerous for us to get the virus that causes chickenpox when we were older. So they wanted to make sure that we got it in a setting where it was going to protect us by training our immune systems to recognize that virus, and also when it was likely not to cause us very much injury, right?
Mm-hmm.
But that vaccination is literally giving you the virus. But
Wow.
these are so far removed. These vaccines are so far removed from that, that they're really a very safe way to train your body to recognize. So if you think of live virus as, you know, viral DNA plus proteins, and then one step for that would be, you know, maybe killed virus, right?
Gotcha.
Or attenuated virus, killed virus before that. So this is like not even viral proteins. It's like the recipe book so that your body can make viral proteins and recognize them. So it's so far away from anything that could possibly make you sick.
Gotcha. Gotcha. That's good information because I think a lot of us aren't really clear about
Yeah.
how it works and things of that nature. So now how does the booster work with your, if you've already gotten the vaccine, how does that booster work on that?
Yeah. So essentially what the booster does is give you a stronger immunity and more durable immunity, right? So the people who are now eligible for the booster are people who have immune suppression. So like lupus patients who take immune suppressing medications. But the other thing to think about is when you have lupus, because your immune system is worried about the wrong things, it's attacking your own body, right? It makes it a little less able to clear viruses and bacteria. So just having lupus is considered a relative immune suppressing disorder because it prevents your body from fighting infections as well. So right. So what the booster is doing is it gives your B cells, which are the cells that make antibodies to viruses, a little bit more of a stimulus to make more antibodies, so higher levels of antibodies. And we also think it increases the durability of response. So, you know, your body will remember for a certain period of time. And then it seems like, especially with the Pfizer vaccine, after about 8 months or so, that immune response is weaker. So what the booster does is it boosts you back up and allows you to have a longer period of time where you can recognize the virus.
Gotcha. That's very interesting. I actually got the Pfizer.
Yeah.
And this is my question, actually. This is actually it, and I think it's pretty important. I actually went to my doctor and asked if I could see what the levels were. So is there a certain level that the first 2 shots should give you to make sure that you have some type of protection from COVID?
So that's a great question. And the answer is we can measure the levels, but we don't know what levels correspond with protection necessarily, right?
Gotcha.
So, you know, what we can do is we can take your blood, look at the level of antibodies that are effective against COVID-19, and we can even take some of your white blood cells that should fight virus, put them in a dish with the virus and see how well the white blood fights virus. But because the immune system is so complicated, we can't say how well those lab tests predict.
Yeah, well, correlate,
correlate with how well. But we do know that some people who got the vaccine in the beginning, especially people who are older or people who are immune suppressed, are getting more serious breakthrough infections.
Oh, wow. Wow. That's interesting. The Broken Medic says, would J&J be more risky since they linked GMB syndrome to the vaccine?
Okay, so Guillain-Barré syndrome. So not necessarily. So remember that a lot of these adverse events are on the level of 1 in a million. There are also adverse events that are associated with the Pfizer and Moderna vaccines. There have been rare cases of Guillain-Barré. There have been rare cases of myocarditis, which is more. It's been reported almost exclusively in young men, so teenagers, 30s men. But in any case, I always say anything that's strong enough to work, anything strong enough to have an effect is strong enough to have a side effect.
Of course.
These trials is so that we know what side effects we're at risk for.
Right.
But, I wouldn't necessarily consider J&J more risky. The caveat to that is that the American College of Rheumatology does recommend that patients with autoimmunity get the Pfizer and Moderna.
Okay.
The J&J. And the reason
Why is
for
that?
the primary reason for that is that at the time that the recommendation was made, booster shots were available for the Pfizer and Moderna, whereas they were not available for the J&J. That has changed more recently. But I think another reason why I personally prefer the mRNA vaccines over J&J for autoimmune patients is that we just have more data on them. We have much more data on them in autoimmune patients.
Gotcha.
In a series, so we published on this, and in a series of patients we looked at whether or not people who got the vaccines were likely to have a flare-up of their lupus afterwards, and also lupus patients had strong antibody response. And what we found was there was no increased risk of flare-ups after the vaccine, which is wonderful. And we also found that lupus patients were made on average about half the antibody levels as normal healthy people. But when we looked at people in the lowest antibody group, so the people who made even lower antibody response than the lowest response of a healthy control, we only had 4 J&J patients in that study, but all of them were in that very low response group. And that's sort of similar to some of the information that we have from the general population, where people who got the J&J vaccine maybe made lower antibody titers. So,
Gotcha.
I think the response to the mRNA vaccines is probably a little bit stronger, and we have more information about it. So I personally just say mRNA vaccines.
Right. Right. That's interesting. That's very interesting. Now, I know mixing and matching. Uh-oh. Am I breaking up? Can you hear me?
I think I may be. Yeah, I can hear you. It's okay.
Is that better?
It's just the internet. Yeah, it is.
Okay. Maybe I shouldn't sit back. Here in Virginia, they've been talking about mixing and matching. So I know you said that, probably the mRNA is probably better for us who have lupus. Do you suggest that people, if they can get the different ones, should they do that, or should they stick with whatever they have?
I would say stick with whatever you have. But I will also mention that mixing and matching has been cleared by the FDA. Okay. So one thing to understand is there's a difference between FDA approved and FDA cleared, right? FDA cleared means from the information we have, this appears to be safe. We have not tested the specifics at the level of rigor that we would usually, under the circumstance that we approve, FDA approve something, right? So all of the trials that were done for these vaccines were done with the same vaccine given as part of a series. There are trials of mixing and matching happening, but the information, the results of those trials have not been released. So, again, the most conservative things to do based on the information that we have that is the most solid is to get the same vaccine.
Gotcha. Gotcha.
Yeah.
And do they know whether it's going, my second shot, I was like, oh my goodness, I can't take it. I was like, wow. But do we know if it's going to have the similar effect? I know they were saying like it's half of what the second shot was.
I got my third shot because I'm patient facing, and it was the same as the second shot.
Oh no. Ah!
My friends who got a third shot is the same as, it's a booster, and your immune system reacts to it, and it's a thing. Yeah, I definitely.
Yeah.
I was very silly because I did it on a day where I could not take off work. I had all these talks to give and all these meetings, and I was just completely so
yeah. Yeah, that second one is a killer.
Yeah. Second one I was able
It definitely will. Yeah, it definitely woke your body up. But what I'm noticing is I'm part of a long COVID group on an app that I use to track my symptoms. And what I've noticed in that long COVID group is that a lot of their symptoms are starting to mimic lupus.
Yeah, I know.
It's like they all of a sudden got lupus.
Right. I think that long COVID is going to be very interesting because, and they mimic the symptoms of lupus, but they mimic we call them like the type 2 symptoms of lupus. The ones that we're not good at treating. The fatigue, the like brain fog, right? All of these, the mood disorders, right? All of these aspects of lupus that as physicians traditionally we're like, oh, is that related to the immune response? We're seeing people with long COVID get those symptoms. So I think it's going to be really interesting when we start to understand the pathogenesis of long COVID to understand how those symptoms are tied to the immune response.
Right. It'll definitely give us a lot of information as to how bodies are reacting. Let's see. I'm trying to get back to a question that I saw up here, but my little phone is tripping out here, so I'm trying to get to it. It was a question by Hooker TC, I think it was. Do you see it on yours?
Let me see. Should we get the third shot? Is it necessary?
Okay, there you go. Thank you.
I am recommending that my lupus patients get the third shot, particularly based on that data that we're getting from our lupus cohort that patients with lupus, especially, so patients with lupus in general made a weaker response to the vaccine than patients without lupus, but there are some conditions that especially made the response weaker. So people who were on steroids, especially more than 10 milligrams of prednisone, made a weaker response. People who are on methotrexate and people who are on B-cell drugs like rituximab. So they made the weakest response. Also, Cellcept was one of the ones that was associated with a weaker response. So we did find, interestingly, that people who are either on hydroxychloroquine alone or people who had blood markers of active lupus. So their double-stranded DNA was higher at the time of the shot, or the complement levels were lower at the time of the shot. Those people were more likely to make a strong response than the COVID-19, which is kind of interesting because, in some of the genetic testing that we're doing, people who do better with COVID, we find that people who have more active interferon. So interferon is one of these chemicals that the immune cells make that orchestrates inflammation, right? But the kind of inflammation that it coordinates is antiviral inflammation. It also happens to be the immune chemical that's very common in lupus, and people who have those blood markers of active lupus tend to have more interferon, right? So even in healthy people who make more interferon are more likely to clear COVID-19. And then also people with lupus who make more interferon are more likely to make a strong response to the vaccine. So it makes you wonder if some of these adaptations that we see in lupus are really our bodies trying to do a better job of fighting viruses.
Right. Our body actually trying to work from whatever
Right.
medicines we're taking and everything. Right.
Right.
That makes sense. That makes sense. It's so interesting. You think that when you're talking to people all over the internet, everything's on the internet and everybody has an opinion and everybody's an epidemiologist, everybody's a doctor. But when you get the right information, it really makes more sense to just be more educated and get the vaccine if you can.
Yeah.
And just, work with your doctor to do what's right for you.
Yeah. And I'm seeing a couple of people mention that they had side effects from the second and third shots, which I understand. I mean, I definitely had the fatigue and the muscle pain, like my arm hurt for a couple of days. One of my colleagues, his arm hurt for a week after the vaccine.
That was me.
Oh no. I think, those symptoms are very unpleasant, but they do go away. And what stays is the protection from COVID-19. So, it's one of these risk-benefit analyses where we know, so if you're unvaccinated, if you're a person who doesn't have lupus and you're unvaccinated and you get COVID-19, the odds that you die are 1 in 30. If you are vaccinated and you get COVID-19, the odds that you die are 1 in a million, right? That's for the general population. In lupus, if you get COVID and you're unvaccinated, the odds of death are around 1 in 10, actually. So it's So it's much more dangerous for a lupus patient to get COVID-19. And so, when we balance that risk benefit, a lot of people who get this, especially the second and third shots, are going to get that low grade fever, that headache, that fatigue, arm pain. But once that goes away, you're so much more protected that it ends up being worth it.
Right. Absolutely. Let's see what we have here. I think the other question that people were sending me was, what do you say to people who they just don't trust the science? You can't change people's mind, but some people just don't trust the science.
Yeah. I mean, I mostly try to listen because I feel like, there's this blanket, some people don't trust the science, but when you get down to it, it tends to be a whole host of different things for different people,
Yeah.
And sometimes it's just listening and trying to figure out what it is that is causing them to be hesitant, right? A lot of times you can help that with education. Sometimes you can help that with just understanding, right? Like a lot of times people will get worked up or emotional about something and they'll dig in. And the fact that other people are like, you're stupid, just take this, makes them dig in more, right?
Right.
Okay, I understand why this is scary to you. I get it. It is a very new thing, and there are some answers that we can't give right now. But based on the information that we have, this is the best thing for your health. Yeah, that can also be helpful.
Yeah, it definitely is. It definitely is helpful. And it's also helpful to have a doctor who is willing to talk to you more about that and really discuss how you're feeling, to get rid of some of that fear and some of that doubt and things of that nature.
Yeah, for sure.
Now, how are they really, when people are going to the hospitals, and I know you don't know about everybody, but when people are going to the hospitals, are they saying that they have lupus and that's how they're tracking it? How are they really tracking lupus patients or even autoimmune, any type of autoimmune disease? How are they tracking that?
Oh, you mean how people are doing with the vaccine?
No, when if someone gets sick, if I get sick and go to the doctor, I always say, I go to the same doctor all the time. I have to go to the same hospital if I'm ill. Like how are they making a note of that to say, okay, this person has lupus, we have to deal with this. She's on Bitlista. You know what I'm saying?
Yeah. So the medical chart. So this is another reason why it's important to make sure that you're seeing a doctor at either the same place or that has access to your medical records. I like making sure that my patients are all within the same healthcare system, because that way everything that's gone on, you can check the medical record, know what medications they're on, if they have lupus, their complications, and all those things. And I think that that's more safe for lupus patients rather than having disjointed care. Yeah.
Right. I know Vinny Vidi. I'm not going to try and say y'all names, y'all. I'm sorry if I'm butchering it up. She said, I'm starting Bitlista tomorrow, just stressing about the side effects. And that's off topic, but we always get off topic here.
Yeah. Bitlista is so well tolerated. I have to say,
it really
Bitlista is one of the drugs. I mean, granted, it is stupid expensive, and so if it were less expensive, I would probably use it more. But I do find that patients who get Bitlista tolerate extremely well. So, I'm not sure if you know about the mechanism of Bitlista, but essentially, there are different flavors of white blood cells. There are lymphocytes, which among them are the B and T cells, and the B cells are the ones that go on to make antibodies. So when we do anti-nuclear antibodies or anti-double-stranded DNA antibodies, those are proteins that are made by B cells. So what Bitlista does is, so as B cells mature, they go from the bone marrow to the lymph nodes, and in order for them to grow into healthy, mature B cells that can make antibodies, they actually need a little encouragement. And so they get their encouragement from this chemical signal called bliss, which sounds very happy. So what Bitlista does is it takes away bliss. And so it decreases that signal for those B cells to mature into cells that can make autoantibodies. So, I say that to say it's extremely targeted. And so it's not like one of these things, like prednisone just like takes out all of the, it's just like a very blanket, we're going to get rid of immune activity from these white cells, period, right? And so you can get a lot of side effects, where something like Bitlista that's more tolerated, people tend to more targeted people tend to tolerate very well.
Yeah, I'm on Bitlista. I've been on Bitlista since pretty much it came out. And, my body, I was a little nervous, but, I talked to my doctor about being nervous. But like he says to me with everything, the side effects do not outweigh the benefit of what I'm going to, gain from it. And I've gained a lot of my life back from Bitlista. Yeah. It's not for everybody. But it works for me.
A lot of docs are like not so impressed with Bitlista. In lupus, we always do trials and we say, is this better than standard of care? So standard of care is not nothing. It's your hydroxychloroquine, it's your Cellcept, it's whatever else you might be taking. And Bitlista gives people, on average, 15% improvement from their standard of care. And so some docs are like, it's really expensive, 15% improvement, whatever, right? But where I like Bitlista is that for the patient that it works well for, it works very well. And it's really good at long term, right? So apart from hydroxychloroquine, Bitlista is the only medicine that has been shown to prevent damage, which is like injury from lupus or its treatments to the body over time. So people who do well on Bitlista live better with their lupus and have less like scarring and disability thereafter. So that's a reason to try it.
Yeah, definitely is.
Yeah, people who do well on Bitlista.
Yeah, I mean, if you do well, you love it. If you don't, of course, you hate it.
Right.
Broken Medic says, what about lupus patients that will flare with little things? Would it be safe for them to receive the vaccine?
Yes. So, I mean, the caveat to this is that every lupus patient is different. And so whenever we do studies, we look at the average, right? On average, do we see that lupus patients have more flare-ups after they get these vaccines? The answer to that is no. And so, you know, from my experience with my patients and from the aggregate data, even lupus patients who have more frequent flares can and should get the vaccine.
Right. Absolutely. Absolutely. Thank you. I mean, your explanations are very good, and it helps to at least ease the mind a little bit, to be knowledgeable. You know, we all want to know exactly what's going on in our bodies. We never know, you know, what our levels are, and if we do know what our levels are, we're so confused with it. You know, we just don't understand it. But your explanations are really good. So Cindy Moon says, good evening. How long should you wait to take the third vaccine? Some said wait 6 months after the second vaccination.
Yeah, so that depends on who you are. So for people who are not immune suppressed, the idea is 6 to 8 months after you get the first vaccine. But for people who are immune suppressed, you can get it 28 days, at least 28 days after. So for patients with lupus, it's at least 28 after the second shot.
Wow. Okay, I didn't know that. I thought it was always 6 months. But I didn't realize it was 28 days after. And then someone asked, thoughts on the new medication that came out. I forgot the name of it. Something with an S,
there
isn't
are
it?
a couple. So there's voclosporin and anifrolumab. I'm not sure. So those are two that, and then also obinutuzumab is about to come, I think.
Okay.
So it depends on which one you're talking about. But anifrolumab is interesting. So that interferon that we talked about, anifrolumab is an anti-interferon. The results look really good. I mean, it's actually, that medicine was an interesting story because there was a trial that was done and the phase 2 study looked fantastic. Like the results were amazing. And so they did a phase 3 study, but they changed the way they measured response and it failed. And so everyone was like, everyone was like all excited. Oh my God, anifrolumab. And then the phase 3 study failed and we were like, how is that possible? So then they went back and did it again, but they used an endpoint that's a little bit more sensitive, and it passed the trial. So that's why this is coming out. But yeah, I mean, it's anti-interferon. Interferon is, we know, a part of the lupus immune response all day. So, you know, it's one of them that is very promising and it makes sense mechanistically. You know, the thing that I worry about in the middle of a pandemic is, you know, interferon also helps us fight viruses, including COVID-19. And so I'm not sure how in this scenario, patients who get anifrolumab are going to fare. I mean, granted, we give rituximab for bad lupus, and that also prevents you from responding to vaccines very well and fighting virus very well. So, you know, if your lupus is bad enough, that's your threat. And so you treat with what you have to treat. But, you know, at the moment.
No, go ahead. You go ahead and finish.
Oh, yeah.
As a doctor. You go. I love it.
Go ahead. Okay, me. Okay, I'm just saying at this moment, I'm leaning more towards like standard of care, just because I'm a little freaked out at giving interferon in the middle of a pandemic. Okay, go on.
I got you. I was going to ask how do doctors determine which, now that there's so many different drugs coming out for lupus, to treat lupus, how does a doctor determine which one would work better? Or is it just, you know, it's a shot in the dark as to how their levels are and things of that nature?
Yeah, I mean, it depends on how your lupus is affecting you. So I say Plaquenil is like vitamin P. Like I want all my lupus patients on Plaquenil. You know, like of course if you have eye toxicity or something, then I have to take you off. But like my baseline is Plaquenil, and I'm a person who likes vitamin D, especially in people who are vitamin D deficient, because I like medicines that are immunomodulatory and not immune suppressing, right? So I want to give you a medicine that's going to allow your immune system to behave more normally, but not prevent you from fighting infections the best I can, right? Now, my hydroxychloroquine and vitamin D is for the patient who has rashes and arthritis, like the milder symptoms of lupus hair loss, things like that, right? So those are the patients who tend to do very well on just the basics. If someone develops kidney disease, particularly, there's a host of medications that we can give. So you do an induction period, you do a maintenance period, and you can either give Cellcept or cyclophosphamide, which are heavier drugs, immunosuppressing drugs, with steroids. And then people who don't do well on that, I move to rituximab. Now, anything in between, like your serositis, which is like the inflammation of the lining of the heart or lungs, you know, things like antiphospholipid syndrome, stuff like that. Like you're on the spectrum of Cellcept, azathioprine, those kind of drugs. And then depending on the blood markers, there are some people who can do really well on Bitlista, which I will offer as well when I need a little bit extra. Yeah.
Right. That's interesting. That's interesting. It's interesting to see how you determine all of that. You know, I think a lot of people really want to know, why are you giving me that? You know, and are afraid to ask that, you know. So that's very interesting. Karen, yes, we will be saving this live. It will be replayed. So that's interesting. Well, I think that is just, it's very hard to determine whether you should get the shot, but you should always check with your doctor. And you should always weigh out the pros and cons. I've gotten to the point where whatever I take, I'm going to write a list. And I'm going to say, this is the good about it. This what can happen if I take it. This what can happen if I don't take it. And I go through that list with myself, and, you know, I go through it with my family, and I discuss it with my family. It's real important to do these things together because they're going to be caring for you if something happens. And I really do discuss it with my doctor. And I go in there with my question. I'm like, you're not rushing me out of here. I'm sorry. I'm calling you with a list of questions.
I mean, I totally support that strategy. I always say, like, so I see my patients and like call them on like Friday afternoons or like my patient call day, where like the patients who I saw that week, give them a call, talk about their labs, any questions that you have. And I'm like, you know, think of something now, write down whatever, and then we'll talk about it. But yeah, like involving the family, yes, like definitely. They're your support system. It's also like, you know, I don't know, when you were like younger in dating, you had like a guy that you were thinking about like staying with or breaking up with, and you had pros and cons list and you went over it with your girlfriends. That's how you should treat your medicines, you know?
Absolutely.
You should have a leave him or keep him list. You know? Pros and cons for sure. Yeah.
Absolutely. Awesome. Thank you so much. This has been so educational and so helpful, especially because, you know, it's such a big deal now. What can we really expect, you know, after this booster? Are they thinking that there's going to be another spike, or is the booster going to handle any other strains? You know, all the questions that you have.
These are all questions that we do not know, and that is frustrating. You know, one of the things that we don't really know is how do we get durable immunity, right? When we have our childhood series of vaccines, we know we take like 1-2 shots and the booster later, and then we're protected until we're adults, right? We don't know that about this virus, right? The other thing that we don't know is mixing and matching. Does that help us get a durable response, right? Like Johnson & Johnson is viral vector that may engage parts of the immune system that mRNA doesn't get to, perhaps. And like there's some data from the UK, especially people who got so AstraZeneca vaccine is similar to Johnson & Johnson in that it's a viral vector, and people who got the AstraZeneca and then an mRNA actually had stronger and more long-lasting immune response. Is that the way? I don't know. You know, the variants. I mean, I think what's probably going to happen is that COVID-19 is going to become endemic instead of pandemic, and what that means is essentially it's something that goes through human population every winter, but it's not as bad as this is, because by that time everyone will have either have had an infection with it or has had some immunity from vaccination, and so people get like cold symptoms rather than like a hospitalization and dying. So that's probably how this is going to turn out.
Yeah, similar to, I guess, the flu.
Yeah, right. And some people get bad flu, and some people die from the flu. But like, you know, it's not something that we have to close our doors for every year, and that's because we have some semblance of immunity in the general population. You know, COVID-19 jumped species, so you know it was the first time the human population saw this virus, and whenever that happens, the virus tends to be much more dangerous to us.
Gotcha. Because a lot of people who don't know about it all thinks that COVID just came out of nowhere, but in fact, it has been around. It just hasn't been in humans like it's going through now.
Yeah. It probably jumped to us from bats. Which
really?
Bats are, oh my God, bats are the reason. You know, so just sort of an interesting science out for a second. Bats have a little higher body temperature than we do. And so they can harbor all kinds of viruses. So everyone has like a microbiome, like viruses and bacteria that just kind of live in them. So bats can harbor all kinds of viruses that are dangerous to everybody else. And then if they like jump from bats to other population, it just like kills us all. But bats are just like chilling with these viruses, like Ebola.
Like, I'm good.
Yeah, right? Like bats hang around with Ebola. If we get Ebola, we're like dead. We're done, right? But bats are just like, I'm good with this Ebola, you know. Anyway,
it's weird. It's really weird. We need to just leave the bats alone.
Just leave the bats alone. Just leave them.
Yeah, definitely. I love it. Well, I so appreciate you coming on and discussing this important topic with us. We always have a great conversation when we're with you, and we get so much information and so much great education when you come on. So I appreciate you coming on and taking some questions and talking to some people and, you know, letting us know exactly, you know, what's going on with COVID and your body.
Yeah. Happy to help. I hope you guys got some information from this.
Definitely did. So thank you so much, Dr. Blazer. I so appreciate you all the time. You know, I love talking to you. I can talk to you all day. So I appreciate you coming on, and I don't have any other questions here, and I don't see any other questions in the chat.
Okay.
So do you have any little bit of advice that you can leave us with regarding the COVID-19 booster shots?
Yeah. Okay. So I would say, understand what the risk-benefit analysis really is, right? So a lot of people, when they think about the risk of taking the COVID-19 shot, what they're thinking about is, I'm healthy right now. I don't have COVID. What is the risk of taking this thing? Put this thing in my body when I'm doing okay right now, right? But the risk-benefit is really, you're in an environment where there is a potentially deadly virus circulating, right? So it's not just how you feel today, it's how you could feel and what could happen in the case that you become exposed to COVID-19 and get sick with it, right? So, you know, when we're talking about the risk of getting the vaccine, we're opposing that to the risk of getting COVID and also the risk of passing away given that you get COVID. And I think the other thing that I would say is a lot of people, especially people who are otherwise healthy, fairly young, they're like, oh, well, even if I get COVID, my body's probably going to be able to fight it off. And so this is a personal decision. But it's really not a personal decision, right? When you get COVID, even if you don't do poorly with it, the probability is you're going to pass it to someone, especially with this Delta variant. So with the Delta variant, we talk about this number called the R naught, which is given that a person gets sick with COVID, how many people are they expected to then infect, right? So with the original virus, it was between 1 and 2 other people. With this Delta variant, it's 5 or 6 other people, right? So yeah, it's much more infectious. So, you know, you have to think about the decision that you're making for your community. And it's not just random people that you might infect, it's people who you're around. So it's your loved ones, it's the people in your community, your mother, your father, your aunt, your uncle, you know, your children. Those are the people who are at risk given that you get it. And some people don't have a choice. You know, some people, like people with lupus on immune suppression, you know, even if they get vaccinated, they're not going to be as well protected, right? So you have to protect them by protecting yourself, right? You're deciding for other people when you decide not to get vaccinated.
Right. It's an act of doing good for all, not just for yourself.
Absolutely. It's an act of kindness. It's an act of selflessness. And that's really why I got my booster shot, right? Like I'm a healthy person, but I take care of patients and they're immune suppressed and I love my patients, right? Like how could I live with myself if I didn't do everything that I could to protect myself so that I could also protect these patients who I care for, right?
Right, absolutely. I saw one last question that came up, and we should still wear masks, right?
Yes, we should still wear masks.
because even though you have gotten the shot, you've gotten the booster, there's still a risk. It's not a cure, so it's still a risk.
Right. So yeah, masking still does increase transmission. So masking, washing your hands, all of these things. Yes, masks have helped tremendously. And also we're finding that even people who are vaccinated are able to pick up. So they're less likely to pick up the virus, but if they do pick up the virus, they can get the same amount of virus growing in their nose and mouth as people who aren't vaccinated. So even though that vaccinated person is less likely to get very sick, they still can pass it to other people if they become infected. So yeah, so still mask, definitely still.
Yeah, and I guess the mask will stay until they really figure out, you know, how the inoculation will work for everyone, I guess.
Yeah. Or in the case that it becomes endemic. I mean, this pandemic will definitely evolve over time. So, you know, but I think masks are here for us at the moment. I don't love it. I get acne from the mask. I'm like still trying to figure out gosh, I look like a teenager. I'm like, what is happening here?
Why?
I used to have like smooth chocolate skin, and now these masks, and I have like all these scars. But you know what? I'll do it to protect the public.
Right. Somebody said in the chat that they like to keep the mask on because they make too many faces. That's me too. Everything shows on my face. So it's like, yeah, I'll keep it.
Yeah, keep the mask so you can have a little poker face. Yeah.
Right. Well, thank you so much, Dr. Blaze. I so appreciate you, and I appreciate your information and your knowledge. I just think you have a brilliant mind, and I'm so happy to be in contact with you.
Thank you so much. I'm so happy I get to disseminate some information, and talking to you is always a pleasure.
Awesome. Awesome. And I'll be in contact again for the next one.
Let me know. I'll be here.
All right. Thank you so much, Dr. Blaze. I don't want to take up too much of your time at 7:46, so I definitely want you to, get relaxed and chill out for a little bit.
It is time.
It is. Thank you so much. Have a great night.
You too. All right. Bye-bye.
Thanks to everybody for tuning in. I so appreciate you all tuning in. And this was a great, great informational session. But like I said, always talk to your doctor about what's going on with you and what you need to do for your health, because you and your doctor know your health and your body the best. So thank you to Dr. Blaze. I love her because she's such a great doctor who listens, and she has such a wealth of knowledge within her that she shares so eloquently and so easily to understand with everyone when she comes on. So thank you everybody for coming on. I hope that you all have a great evening. This will be saved on this page, and it will also be on our YouTube page and our Facebook page. Please send it out to a friend and let them get a look at it so they can have a listen to what Dr. Blazer had to say. Thanks, guys. I appreciate you all tuning in, and thank you for all your questions. Bye.